cancer. So who better to talk to than our buddy, Dr. David Samadi, the chairman of urology and chief of robotic surgery at Lenox Hill Hospital, and also professor of urology at Hofstra North Shore-LIJ School of Medicine. Hey, Doc.
Hey, Steve. Good to see you.
Well, congratulations on all the new affiliations and directorships and professorships, and that's great stuff.
It's a wonderful institution, and I have to tell you, we went from a hospital to a whole healthcare system, which is tremendous. And what they're doing for us at Lenox Hill and the way they're helping me to take care of my patients, and a great opportunity. It's a privilege to be there, and I appreciate the introduction.
No, my pleasure. You deserve it. Okay, now, tell me what the heck I should do. What do you think of this fish oil study, which I understand is not the first of its kind to come up with the same conclusions?
Well, you know, a lot of people are confused now because for years we said take your fish oil, omega-3 fatty acid is great for your health. And certainly everything we said about prevention of stroke and heart disease still remains, Steve. So that continues to be very helpful. The anti-inflammatory process that omega-3 does is great for the protection of the heart. This particular news is coming in right after, if you recall, a few months ago about vitamin E, and also that could also absolutely the cause of prostate cancer, but they found some association. It wasn't set up for this particular reason, but one of the sidetracks of this is that there is some correlation between high dose of this fish oil and prostate cancer. So I want people to be careful. If you have family history of prostate cancer, if you have high elevated PSAs, talk to your doctor. There are blood tests that they can check to see if you're taking too much of it or not enough, and they can adjust the dose.
So you're saying there is a blood test that could be taken to see if you have too much omega-3 in your blood?
Yes.
Okay, that's only for the individual. Do I want to know this? Well, should I go get this blood test? Do I want to be aware of that I might have a short life, that I might get this illness, that illness? But also, if you take this blood test, or if they make you take this blood test, and even if you don't want to know the results, in today's day and age, I'm of the opinion that every insurance company, every employer, every doctors, or every government branch, they'll all know about this about you. And it sets up all kinds of dangerous, horrific scenarios about people being discriminated against in every way, shape, or form because they're going to die young, they're going to get cancer, they're going to get this disease. What's the future of this blood test?
Well, look, I think it's just the beginning of this, and we certainly need a lot more research to go on, but your point is absolutely well taken. If there is such a blood test, which we'll see if it's going to really pan out to be a reality or not, it's still at the early stage of this. But if it's going to, for example, tell somebody that they're going to have colon cancer, where on one hand, looking at this is, if you know that you're headed toward the colon cancer, we can screen better, we can watch the patient and certainly keep them healthier. On the other hand, exactly what you said, that particular knowledge may warn all the insurance companies that this guy is at high risk, and all of a sudden we're not going to insure him and can cause a lot of issues, plus privacy reasons and all the information that can get out there. So it depends on how you look at this. My view of this is that on the scientific way, we're getting into the fingerprint of molecular genetics. I think that the science is being advanced, but sometimes this science could be quite dangerous based on what you just mentioned. Interfering with evolution is not always the best thing. So I am skeptic about this and have mixed feelings about this. Whether it's going to be a reality in the future, it's still too early to say these blood tests. This is a study that was done in about 6,000 twins. They look at a particular molecular pathway. A lot of times these have many years to go before they come into our clinical path. So I wouldn't worry about it at this point. It's not clinically available. But, that's unfortunately when you have interference with the science, we may run into those kind of troubles, Steve, and sometimes you can avoid it.
We're talking to Dr. David Samadi. He is the chairman of urology and chief of robotic surgery at Lenox Hill Hospital here on the Steve Malzberg Show. Yeah, one other thing, they say that this test would be done at birth. And, call me a skeptic, but knowing what we know about, the IRS and everything else and the scientific advances, I wouldn't put it past, let's just say, a government that has this capability to do it secretly and somehow keep a file on people and set it up as some kind of experiment. I mean, what's to stop any government from doing that?
Yeah, I agree with that 100%. And if they can get into everyone's cell phones and everyone's information, and then this information, I'm sure, will get out there. And you're right. I mean, what if you want to run for an elected position, and if somebody will get a hold of this and know that you're not going to be around, so it really can change people's lives. And this is something that, again, they want to know this early on, right at birth, whether, again, we've seen in my field so many of these tests that will come and will go to the side. I'm not sure if it's going to become a reality, but certainly there's a lot of mixed feelings about this test.
All right, let's move on to Elton John. Hasn't been a lot of publicity about this, but Elton John had to postpone his concerts for the summer after being diagnosed with appendicitis, and they say he's going to undergo surgery in the next few weeks. And it turns out he got ill in Europe, and it was a diagnosis of an appendix abscess surrounding the retroaceal appendicitis. I don't know. They found out through scans and blood tests. And supposedly, according to him, he says he could have been dead. He's very lucky, insinuating, and I'm only a layman, that the stuff that would burst, then would go into your bloodstream if your appendix burst, was already leaking out.
Yeah.
Is that something that's common? I mean, I thought you feel a pain, you go get checked out, your appendix, you got to catch it before it bursts. But this long-term kind of leakage, that I've never really heard of.
Yeah, so, I mean, I'm not sure where he was when he was diagnosed, but usually we don't do watchful or watch appendicitis. If somebody has inflammation of the appendix, which is called appendicitis, and if that's a clinical judgment by seeing pain on the right side of the abdomen, you do surgery. You don't sit on this, because if you continue to watch this, as you mentioned, the appendix can perforate, and then you have a major crisis in your hand because the stool and the infection can get into the abdomen, something called clinically peritonitis. That person can get very sick with high fever and can actually die. It's true. There are cases of people where we cannot catch up with the infection despite IV antibiotic. So if there's clinical suspicion of appendicitis, surgery, most likely laparoscopic, a minimal invasive way of removing it, is the way to go. As to why they watch them, they let this become perforated, and I'm not sure if it was in Europe or not. I don't know, but they should have operated on him, and that would have been the end of it. A couple of days, and he recovers, and he's back on his feet. Now he's gone too far with like possibility of abscess, which is the collection of pus, perforation. It's not good news. It's going to take him longer to recover. Appendicitis is rare in adults, but it can happen. It usually happens in younger adults. But when it happens, you got to take care of it quickly before you let it burst and cause all this infection in his abdomen.
All right. Doc, I appreciate your time as always. Have a great weekend. Dr. Dave.